Hi and welcome to our telehealth video information series. I'm Garvin and this video is on Cyclogest. So what is Cyclogest used for? It's used for premenstrual syndrome or PMS and postnatal depression, supporting pregnancy in women having assisted reproduction treatment such as IVF. And how does Cyclogest work? So Cyclogest Pessaries contain the active ingredient progesterone, which is a naturally occurring female sex hormone. Progesterone is essential for normal functioning of the reproductive system, and its levels naturally fluctuate throughout the menstrual cycle. After ovulation, if an egg is not fertilized, the level of progesterone in the blood falls before a menstrual period starts. Some women find that using progesterone for 12 to 14 days before their period starts can relieve the symptoms of premenstrual syndrome. However, it's not fully understood how this works, as PMS has not been scientifically shown to be caused by a lack of progesterone in the bloodstream. Progesterone can also be used to treat depression following childbirth. The placenta produces progesterone throughout the pregnancy, and a drop in progesterone levels after birth may be partly responsible for postnatal depression. Progesterone is also used to support early pregnancy in women having in vitro fertilization or IVF. In this case, the pessaries are started on the day of egg retrieval. The progesterone acts on the womb lining and causes it to thicken in preparation for a fertilized egg to implant. The progesterone is continued for 38 days if pregnancy is confirmed. This helps to maintain the pregnancy until the placenta develops fully, when it then takes over the production of progesterone to continue to support the pregnancy. Cyclogest pessaries can be inserted either into the vagina or rectum. In both cases, the pessaries melt and the progesterone from the pessaries is absorbed into the bloodstream via the rich supply of blood vessels in these areas. So next is, how do you use Cyclogest pessaries? First of all, always follow the instructions given to you by your doctor regarding when to use these pessaries, how often and for how long. If you're using Cyclogest for assisted reproduction, you should always use the pessaries in your vagina. If you're using Cyclogest for PMS or postnatal depression, you can use the pessaries in either your vagina or rectum. This depends on your personal choice on whether any of the following apply to you. Cyclogest pessaries should be used in the rectum if you are using latex condoms or diaphragm to prevent pregnancy or STIs. This is because Cyclogest pessaries may damage these barrier forms of contraception and so make them less effective. Also, Cyclogest pessaries should also be used rectally if you have a vaginal infection such as thrush, recurrent urinary tract infections such as cystitis, or have recently given birth. Cyclogest pessaries should be used vaginally if you suffer from bowel inflammation or colitis, or any problems controlling your bowel movements such as fecal incontinence. And Cyclogest pessaries should be used with caution in women with an increased risk of getting a blood clot in a blood vessel, also in women with high blood pressure and women with heart disease such as angina or heart failure. So can you use Cyclogest pessaries while pregnant or breastfeeding? Cyclogest pessaries shouldn't be used during pregnancy except for luteal support in assisted reproduction. So talk to your doctor for more on this if you think you're pregnant while using this medicine for any reason. However, as progesterone is a naturally occurring hormone, it is not expected to have any harmful effects. Progesterone passes into breast milk. The manufacturer states that Cyclogest pessaries are not recommended for women who are breastfeeding. So again, if this relates to you, get advice from your doctor. So what are possible side effects of Cyclogest pessaries? So the common ones would be sleepiness, abdominal pain or discomfort, breast pain, hot flushes and constipation when used in assisted conception, and fatigue as well. and rare side effects, changes in menstrual cycle, such as earlier or delayed periods, and discharge of oily pessary base from the vagina or rectum, soreness of the vagina or rectum, diarrhea, and flatulence. So for more on the possible side effects, you can read the patient information leaflet that comes with the medicine, or you can talk to your doctor or pharmacist for more. So can you use Cyclogest Pessaries with other medicines? So it is recommended that other vaginal medicines should not be used in combination with Cyclogest. So the following medicines may increase the breakdown of progesterone by the liver, and so could potentially make this medicine less effective. And they are carbamazepine, oxcarbazepine, phenobarbital, phenytoin, primidone, and rifampicin. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below, or contact me through my website, mytelehealth.info, or call into us at Lynch's Pharmacy in Douglas and Cork, or ring us on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.